So I think there are two potential. So it's just a immediate potential is that humans are subjective. So they're good, but we just not perfect. And from one human to the next, there is some variation. And what's good about deep learning is it really kind of repeats what humans do, but in a more consistent way. And we can definitely replace the human annotation for sleep stages, for most of the things that human technicians look at in the sleep study in a more reliable way. So that's the first thing we can do. And definitely, I think in the future, the same way as EKG are not read by humans anymore, they're interpreted by computers. It'll be exactly the same for sleep studies. However, we can do a lot better, because there's a lot of information inside sleep that we don't even look at. And we have this big project where we are collecting 250,000 sleep studies. And then we're going to look at how people have evolved, like who has developed stroke, who has had heart attack, who is developing dementia. And we really strongly suspect that inside sleep, there might be some prodromal kind of abnormality that could predict some of these disorders before they occur. And what's nice about sleep is it's like when you sleep, you're not busy, you're not doing anything. So we might as well record you. And on top of that, it's not contaminated by moving around, by talking, by thinking, answering questions. So it's just like you go through an automatic kind of checkup routine. So it's a very good way to just kind of a window to brain activity and general body physiology and try to see if something is abnormal. So it's a project that is funded by NIH, and it's a project that we are conducting together with Brandon Westover, which is at BI, in Boston, as well as a group in Southern California, Kaiser and Emory. And we're collecting this, again, 250,000 sleep studies, like the full sleep studies, the EEGs, the EOG, the heart rate, the leg movements. And what's good is that they are linked to EMR, electronic medical record. And then we can see some of these sleep studies that I've collected like they're 10 years old or 15 years old. And then now we can look back at these people in the EMR and see who has developed a stroke, who has had this problem, who has developed dementia, and then use the baseline sleep study to see if we can find something that can predict some of these events. And I like to take the example, that's a really silly example, but I think it could work. That, for example, the EKG, I'm sure you know what a stress test is. If you get a heart attack, sometimes if they want to verify that your coronary artery is working well, they put you on a treadmill and they look at how your EKG changes. And then it kind of shows if your coronary circulation is a little bit like compromised. It's a classic test. And during sleep, when you go through REM sleep, your heart goes in all kind of direction. When you dream, it's just like almost like if you were running. And in fact, a lot of heart attack happens early morning, probably out of REM sleep. So what we hope is maybe we'll look at the ST segment during REM sleep versus non-REM sleep, and maybe we'll find that some people have abnormalities that can predict having heart attacks. This is just an example. So I think we'll probably find a lot of very interesting association. I like to say is that sleep is a little bit like a window to brain health. And it's something that you can do very easily at home. Now the technology is there. We could even do it regularly, which will be even more powerful because predicting cross-sectionally, it's difficult. But if you see something that changes, that might even be more sensitive to tell you that you're, running into a problem. So I think in the future, I feel pretty confident that sleep recordings will be done at home. The data will be sent to a computer. It will be automatically analyzed, and that will probably help the doctors to see what kind of problem you could be facing in the future.